If you could describe nursing in one word, what would it be?
I would have to say invaluable.
Why would you describe nursing as invaluable?
I've been in and out of hospitals for a very long time, and I went in thinking that it was the doctors that made all the difference. And while I still think they're very crucial, I learned that it was the nurses that actually were, to me, the most important character in the healthcare system, and that they were there for me every hour of every day. I saw them 5 times more than my doctor. They took me into labs, into surgeries. They were there when I woke up. I rarely saw my doctor besides when he was working on me when I was under anesthesia. It was one of those things that not only did they take care of me, they took care of my family through all of this. They made sure they had the little things like coffee and a pillow. They were there hand and foot for us. And so they were the most valuable thing while I was there, and I really truly think that without nurses, I would not have enjoyed my hospitalization as much as I did, and I don't think I would have been as successful coming out of it as well.
If you had to, if you don't mind me asking, why were you in and out of the hospital so frequently?
I was diagnosed at 11 with a heart disease known as supraventricular tachycardia, and it's basically when the electrodes in your heart overbeat erratically and uncontrollably. It causes a lot of chest pains and blackout, and it was something that I had to be hospitalized a lot. I have had 4 surgeries for it, and it's definitely taken up a large amount of my time, but it is the reason that I wanted to become a nurse.
Okay. So you mentioned that you had a lot of interactions with nurses. Would you say that you've had any that stand out, either positive or negative interactions?
I've had both, and I think that I think everyone's probably had that same experience. I've had that young, gung-ho nurse that wants to do everything. She always wants to help out, but then she's trying to start my IV fluid and she misses the vein, or she hits the vein but doesn't get the needle in quick enough, and it kind of goes everywhere. But I've also had the older nurses who treat me almost like as their daughter and are so kind and call me angel and baby, but then they can't remember my name or why I'm there.
Right.
So I've definitely had positive and negative nurses, and I don't really think there's one thing that makes them bad or good, but there's definitely variables across the board.
Okay, so would you say that age definitely is a contributing factor to not necessarily the quality of care, but how your care is given?
I would. I think it's just one of those things when we look between us and our parents, we're so used to texting via our parents who are used to emailing. Mm-hmm. And I think it's the same thing with nurses. I know a bunch of us had to go get CPR certified, and we were there with some older nurses, and they were the ones asking so many questions because they were taught a one way that within 2 years it's changed. And so things that they might be the normal, and we're going to nursing class and we're this is a way that you have to do it, always ask questions. I think that there is a little bit of difference between younger and older nurses.
Okay. Do you have any recommendations for future nurses?
I would have to definitely agree with the whole slow down, but at the same time, pay attention. Slowing down doesn't necessarily mean being lazy. Slowing down almost means being more careful. Like I said, I've had nurses that don't even take the time to look at the chart to know my name, mm-hmm. and I'll see them 5 or 6 times a day, and they still can't remember who I am. Whereas then I have those nurses that are so quick that kind of screw up the IV.
Yeah.
So slow down, pay more attention, but take time to get to know who you're helping. Because I can honestly say the nurses that took time to know me are the nurses that have inspired me so much, and I'm sure a ton of other people. They've been a huge role model in a lot of people's lives, those that take the time to get to know us.
Well, thank you so much.
No problem, thanks.